Smoking is a very important risk factor one should be aware of. It's one of the most important culprit for heart problems because it causes thickening of blood, it causes clot formation, which is responsible for heart attacks. It also leads to other issues like lung problems, which also can lead to other breathing difficulty and symptoms like that. And we should avoid smoking, not just active smoking, but people who stay with smokers, that is passive smokers, are also supposed to be very much careful because they are equally at risk for developing side effects of smoking. So it's very important that one knows which symptoms are of heart attack and which are not. Usually heart attack causes a center of the chest discomfort. More often than not, it's described as a heaviness of chest and not more as pain, but heaviness of chest. It can be associated with this symptom radiating to the arm. It can be radiated into the center of the throat or into the upper part of your abdomen. May be associated with sweating. You would definitely not be able to walk few steps when you experience such kind of discomfort. This needs to be distinguished from something like an acidity or other kind of discomfort where you would find that walking and all doesn't increase your symptoms and the pain is on the side of the chest. And if someone hospital where the facility to diagnose heart problems is there, that is bare minimum they should have facility for blood tests and ECG based on which one can diagnose heart attack. So that's something everyone should be aware of. The rising incidence of heart problems in especially younger and middle-aged individual is due to the stress level that we are all experiencing. And the very important factor that one has to realize is that stress not only causes the rupture of the cholesterol blockages which is present inside the blood vessels, it also causes thickening of the blood leading to clot formation. So most heart attacks are due to stress level related clot formation into the blood vessels and causing blockage in the circulation. So stress is the most important risk factor for heart attacks compared to high cholesterol and hypertension, leading to more of blockages but not as much of heart attack. Often in my practice, lot of patients come with heart attack or heart related symptoms, but they don't have any diabetes, hypertension. In fact, got developed in such a very saintly individual because many of us have the genes which are responsible for these heart attack. So our genes determine how is your cholesterol level going to be, how is your diabetes incidence going to be, how your blood pressure is going to be, and in the same way genes determine whether you will get heart attack or not. And hence all the future therapies which are under the pipeline are focusing on the genetic tests and genetic medications, and this is going to be the future of healthcare. So in actual clinical practice, we see that the pediatricians see the kids up to the age of say around 14 years of age, and most individuals are hence next seen by an adult physician maybe after the age of 35 or 40. So the age group between 14 and 35, most individuals don't even go to hospitals or seek medical checkups. And this is one of the reasons why all these risk factors of bad diet, bad blood pressure, sugar starts in this particular couple of decades of 15 to 35. And the result of it is what people suffer between 35 and 60. So yes, people nowadays are seeing heart attacks in younger individuals between say 20 to 35 also, and that's because there are genetic predispositions plus their dietary and stress levels are unacceptable. So the health checkup, the timing of it is a very ambiguous thing, but yes, anybody who has crossed the age of 20-21 should at least get their heart checked up once. I often see patients who say, I did not have symptoms, so I've never got an ECG done or echo done. I think that's not a good excuse. We should not wait for symptoms because we want to prevent problems rather than treat problems. So everybody who is crossed the age of 20 should get themselves checked. The best way to check heart is not just blood test, not just ECG, but to do an echocardiography, that is the scan of the heart, and also definitely do treadmill test, that is giving stress to the heart by walking on a treadmill and recording the ECG at that time. Often people think that walking in gym or walking outside is a surrogate to guarantee that their heart health is good, but no, medical treadmill is the best way to know whether your heart is good or not.